Good afternoon, everyone. Our webinar is going to begin here at 2 o'clock right now. Good afternoon, everyone. I am Kristi Schulenberg. I am the director for the Center of Capacity Building here at the National Alliance to End Homelessness. And today, thank you for joining us for our Effective Diversion, a key strategy for ending homelessness. We have a great group of panelists today who are going to join us in sharing what is going on with their community with regard to diversion. So a couple of housekeeping bits and announcements today. So all attendees are on mute and your video options are turned off, as well as the Zoom chat function is disabled. And so we're asking you to put your questions in the Zoom Q&A box, which you can find at the bottom or at the top, I guess, wherever your Zoom control screen is. Just a highlight, we have an upcoming webinar next week, October 22nd, and that is from our HRI, our Homelessness Research Institute staff, researching an end to homelessness election year policy ideas, looking at the affordable housing crisis. So we hope you can join us for that. The link will be in the PowerPoints, which the PowerPoint and the recording will be available likely tomorrow, and you can find it on our website. So a little bit about our agenda today. We are going to cover diversion, a quick overview of diversion, homelessness prevention, and eviction prevention. However, we're going to do a deeper dive, obviously, into diversion, the what, how, and why. Basically kind of 30,000, 50,000 foot level overview of that. And then we're going to spend more time hearing from our panelists about how they are using diversion as an effective strategy to end people's homelessness in their communities in response to the pandemic and beyond. We are going to have a pretty significant time for Q&A at the end. So again, please put your questions and answers in the Q&A box, and my colleague Mia Bryant will assist in facilitating our Q&A at the end. Okay, so let's begin. So as I said, we'd like to start with an overview of diversion. So to start off, we know that to truly address homelessness during this pandemic, homelessness systems must prioritize their resources on what will have the greatest impact. And the most effective way to do this is to use funding, especially your recent ESG CV funds, to first serve people with the highest needs who are currently experiencing homelessness. So to reduce the number of people who are homeless requires homeless systems to use already insufficient homelessness funding on approaches proven to achieve that goal. And so we want to talk specifically about diversion, homelessness prevention, and eviction prevention. So diversion can have a significant impact on a system because it serves people who have lost their housing and are at the front door to shelter or unsheltered homelessness. Diversion reduces the number of people entering into the homeless system, the demand for shelter beds, and the size of wait lists. As a result, it's an ideal investment for systems to make in order to reduce homelessness. Homelessness prevention strategies, if targeted to people whom local data indicate are extremely likely to become homeless, are moderately effective in reducing homelessness. Other community resources are tapped or should be tapped to support homelessness prevention efforts. And eviction prevention. Research shows that the majority of extremely low-income households that are evicted do not become homeless, at least in the short run. These households do need assistance, but investing homelessness resources in this group is not effective in reducing the number of homeless people, and we're going to get into that a little bit more. So let's discuss for just a minute homelessness prevention and eviction prevention a bit more. So people can mean a wide variety of activities and initiatives when they describe how they are working to prevent homelessness. But today the Alliance wants to distinguish between these three strategies and discuss the most effective way to use resources is to target them where they will make the biggest impact in reducing homelessness. There's very little overlap between people who receive formal eviction notices or become behind in their rent and those who enter homelessness services. So this is not the primary population pool to serve if targeting is the goal to reduce entries into the homeless system and ease shelter demand in order to decompress existing shelter. Most people who enter shelter do so from doubled up situations. They are not typically leaseholders and so don't receive formal eviction notices. Many people who enter shelter after losing their housing never sought help from traditional eviction prevention assistance programs, according to the research and data we currently have. And a community doesn't need to target diversion if it can do diversion with everyone at the front door. But those who are at high risk of homelessness and those who are facing evictions far exceed the homeless system's resources to serve them. So how do we make the most out of the resources that we have? So one way is to ensure we are targeting resources. So let's discuss this when it comes to homelessness prevention. Homelessness prevention programs are narrowly targeted interventions that are designed to reduce entries into homelessness among those who are at heightened risk of homelessness. Homeless prevention is not simply for those who are behind in their rent or facing eviction. So when targeting highly vulnerable people, we don't mean everyone with an eviction notice, but those for whom data indicates are at a higher risk. While imprecise, targeting strategies allow resources to go much further in minimizing homelessness than failing to target at all or using broad eligibility criteria. So an important note about homelessness prevention, outreach may be needed. So people at heightened risk of homelessness may not seek out assistance to avoid housing loss. If you're trying to make every dollar prevent a literal episode of homelessness, you may need to do some outreach in order to do that. So for example, in New York City, people who lost a housing voucher actually never sought homelessness prevention assistance. And so homelessness prevention model, they have a homelessness prevention model that includes outreach. So that's some data and research out in New York City. So targeting interventions is really, again, only necessary when we don't have enough resources to assist everyone. So there must be a strategy in how these resources are going to be used. Will it be first come, first served? If so, it will likely only be by luck that you help those at highest risk. Instead, by using data, your community is making a choice to funnel resources where it has the greatest chance of reaching those reaching those with the least chance to stay out of homelessness. So it's important to distinguish between homeless prevention programs and eviction prevention programs, especially when homeless funding dollars are concerned. So while homelessness prevention programs are designed to reduce entries into homelessness among people at heightened risk, eviction prevention programs are designed to help people who are under the threat of eviction to retain their housing. Eviction prevention programs also often have a broad income eligibility criteria. So for example, families with eviction notices and with incomes below 100% of AMI. Since eligibility criteria is broad and eligible populations is large, resources may be depleted within days and sometimes even hours. So a study of an eviction prevention program in Chicago examined outcomes of people who reached out to the program while the program had financial resources on hand, and those who called when the program's resources were depleted. People who called when the program was equipped to help them were far, far less likely to experience homelessness, and yet of those who sought help and were denied assistance because the agency's resources were depleted, less than 3% entered into a homeless service program. So researchers have stated that the eviction prevention intervention was far more impactful in preventing literal homeless episodes when it was used to assist poorer households. So how can a community make their eviction programs more impactful? So one way to do that is to apply the lessons learned from homelessness prevention interventions when using local data to best help identify people at the highest risk. And communities should consider taking the steps that are outlined here in the slides. Since this webinar is focused more on diversion, like I said, we wanted to only provide a 50,000-foot overview of the distinctions between diversion, homelessness prevention, and eviction prevention. When we provide the slides to you, there'll be some additional information for you to investigate further. So what we like to do is focus now on diversion. So again, as we narrow our focus on diversion, just remember that even applying our best information, homelessness prevention programs will target people who likely would not have become homeless. When so many of the individuals in our homeless service systems lack safe shelter or support to homelessness, it is really inappropriate to divert resources dedicated to assisting people already experiencing homelessness that can be used to meet their urgent needs to serve a population that might never actually experience homelessness. So that's the framework in which we're talking about here. So a little bit about diversion. So what is diversion? Diversion is an intervention designed to immediately address the needs of someone who has just lost their housing and has become homeless. So they have not yet spent that night in shelter or unsheltered homelessness, and we are trying to immediately divert them from that possible situation. Diversion is a client-driven approach to help a household find safe alternative housing immediately, rather than shelter or unsheltered homelessness, as I've shared. The intervention is designed to ensure that the homeless experience is as brief as possible and to prevent unsheltered homelessness and to avert stays in shelter. How does diversion work? Diversion works through a very intensive service interaction. So it is not a denial of shelter, but instead, in fact, a very intensive service interaction utilizing a problem-solving conversation. That problem-solving conversation is meant to understand what caused a person's housing crisis, to explore with them what immediate solutions to that crisis may be possible and available to them, and then to help them pursue those solutions. Those solutions may take form in a variety of ways. They could be short-term, they could be long-term. They could include a negotiated return to their previous housing situation, assuming it's safe. They could be short-term, non-shelter accommodations. It could be shared housing, and it could be returns to family. So just a note, problem solving and problem solving conversations require an investment. So homeless systems and homeless service providers must be prepared to invest in staff training, effective partnerships in the community across all homeless service programs with those mainstream partners. And it may include, not always, but often does include expanded financial assistance to help stabilize that household. And it also includes, most importantly, like homelessness prevention, regular use of data to evaluate and improve performance. So the Alliance has a kind of 6 steps to problem solving conversation, and we'll include the entire infographic along with the PowerPoint recording on our website when we post everything tomorrow. But the 6 steps are pretty simple to understand. Introduce yourself and the purpose of the conversation, which is to help them work with the household experiencing a housing crisis to explore and understand, explore, and pursue those solutions to their immediate housing crisis. It includes active listening, strengths and supports exploration that provide an opportunity to test out what those options are and role play what scenarios may be in front of them. How do they move forward? Creating connections could involve mediation and additional problem solving, negotiation, and then summarizing and following up, which includes action sessions. So again, this is why there needs to be an investment in program staff and understanding throughout the entire homeless system what the purpose is of diversion. So why do we do it? Why do communities do diversion? And we're going to hear a little bit more from our panelists from Connecticut and North Carolina about why they do diversion. But it's because shelter can be traumatic. It can be unhealthy and it can be unsafe. Some data show that people who enter shelter experience longer periods of homelessness than those who are diverted from it. So no matter how well run shelter is, folks prefer to be in housing, and housing is more likely to improve their well-being. Likewise, being unsheltered has a very high risk of negative health outcomes, and given the current situation that we're living in today with the pandemic, this is even more, I think we are all more acutely aware of this reality. It also invites the opportunity for involvement with the criminal justice system, and for communities to approach their homelessness through criminalization efforts. So diversion is much more than just an effective intervention from the perspective of homeless services systems and ending homelessness. It stems the inflow into shelter. Every person diverted makes a shelter bed available for someone else who needs it. It is considerably less costly and on average than a shelter stay. In addition, it avoids the emergency-related costs of unsheltered homelessness, including ambulance use, sanitation, and interactions with law enforcement. So all of that said, let's hear from our community and our communities represented here in our panelists and how they do diversion. So I'd like to introduce to you Denise Nuenaber. Denise is the Executive Director of the North Carolina Coalition to End Homelessness, and we are very grateful to have her here today. Thanks, Denise.
Thanks, Kristi. Let me make sure I share my correct screen here. Thanks, everyone. I'm so thankful that folks take some time out, I know, on what is really chaotic days, both work and professionally and personally, and hopefully all of the chaos that's happening around me here working at home will let us go quickly through these slides as well. I will warn you, we've adopted a cat that had 8 kittens, so we may have some, looks like they're very active right now. Hopefully they'll only come in for a cute glance. Okay. What I want to focus on today is thinking about how to approach diversion with ESG funding, particularly ESG CV funding, as all of our communities have this new resource that we're really working to get out as quickly as possible to people who really need it. And so in North Carolina, we have 12 continuums of care and 24 local planning areas. Just like across the country, North Carolina communities have been experimenting with diversion. Most of that has focused with private funds, with flexible private funds. And I think we've all been excited about the new innovation, a way to really target folks and prevent those shelter stays. But what we're wanting to do is really focus on how we can use public funds for that same intervention. And the problem with this is that you won't find diversion in the Hearth Act. You're not going to find the words diversion in the Hearth Act at all. It's a newer intervention. It didn't really exist. We didn't talk about diversion when the Hearth Act was created. And so it's not an eligible expense category. What I hope we can do is, through this presentation, start to think about it more flexibly. And when we think about it in a different way, we'll find that many of the costs can actually be covered through ESG, which will help us, one, stretch those more flexible private dollars, and two, really help us invest in the strategy that we're seeing as really making a difference in all of our communities. One of the reasons that I think we have been able in North Carolina to think about this differently is because of our experience 2 years ago with disaster. So in 2018, just 2 years ago, this fall, North Carolina was hit by Hurricane Florence. It was a major hurricane, and it was less than 2 years after we had Hurricane Matthew. So we had experienced disaster twice in a row. Here we are 3 times in a row experiencing large disaster, and really, I think we took some lessons learned from that. And one of the things that we really focused on was creating a new approach to disaster rehousing. We knew that there was a group of people, particularly precariously housed, people who weren't leaseholders, people previously experiencing homelessness, that weren't eligible for other FEMA-related housing programs. And so we created a new program with a rapid rehousing approach, and we had to do that very quickly. And I think one of the things in homelessness that is the hardest for us to get out of our boxes and our thinking and our silos is that we actually are using words to mean many things. And so I want to be very clear that I'm saying we used a rapid rehousing approach for a disaster rehousing program. Because if you go by HUD regs, in order to be eligible for rapid rehousing, you have to be literally homeless. We did not go through that piece of it and say you have to be literally homeless to receive rapid rehousing. We used a rapid rehousing approach, meaning housing navigation, financial assistance, case management, and it did not matter whether you fit into that literal box or not. We created Back at Home North Carolina, which is it was a 28 county infrastructure where we took the state, worked to take a lot of the things like inspections, documentation, program policies. We took a lot of that off of our agencies and created a backbone support system. Anything that we could do that would make us go faster, including ordering furniture in Raleigh instead of ordering it across 28 counties, we did that because we knew we wanted to let our case managers and housing navigators focus on the household, on that work that we couldn't do from Raleigh, that we needed them to be focused on and really, again, just go as quickly as possible. So this slide turns out a little blurry, but this is not what you would normally, I think there's toilet paper at the end. This is not a toilet paper joke. This is the laundry detergent aisle. When you think about how we try to solve problems, we come up with so many different individualized, unique solutions. And here we are with laundry, our laundry detergent options in the United States of America. But this is overwhelming. I gotta say, at the end of the day, I don't really care which one is gonna make my whites whiter and my brights brighter. I want it to work. And each one of these, I actually have 3. This is embarrassing as I'm thinking about it. I have 3 different laundry detergents in my household for each individual family member's needs and preferences. But the truth is, what we're talking about here is water, soap, and agitation. It boils down to 3 things. We create all of these different interventions, all of these different names, but it boils down to water, soap, agitation. We do the same thing in homelessness, rapid rehousing, diversion, housing, all of these different things. It boils down to affordable housing, appropriate services, adequate income. It's really just those 3 things we're talking about, whether we're talking about a diversion problem solving conversation, or whether we're talking about a problem solving conversation with someone who's been in our shelter for a couple of weeks. We're all thinking about these 3 things. How do we address affordable housing, appropriate services, and adequate income? And when we think about programs, this is what changes. Who is it targeted to? Is it targeted to vets? Is it targeted to people who are chronically homeless? Is it targeted to people who are homeless tonight, who will be homeless in 14 days? Is it targeted to people who have been experiencing homelessness for 2 years or more? That changes. How long you serve someone changes. Is it a one-time intervention? Is it something I'm going to provide rental assistance, in a permanent situation? And then the intensity. Is it something that it's going to be a light touch case management, or is it something that, we're going to have a lot more kind of crisis level, mental health certified intervention for those services? Or am I going to provide a housing subsidy that is the entire rent, or am I going to provide something like $100 a month? Those are the things that can change across our programs. And for us, instead of saying we're going to make a program with each one of these very rigid of what you can do, we're doing away with that. And we're saying these are the activities. So for Back at Home, these are the things that our rehousing agencies can provide. You guys know this list. It's the flexible financial assistance. It's the housing navigation. We're excited that there's a new, HUD is now allowing some move-in fees with ESGCD dollars. We did that with private dollars before. All of these things, what we're doing with households is we're picking and choosing which of these interventions a household needs, and all of them are going to get problem-solving conversations. And a concrete way that we're doing that here in North Carolina with Back at Home is we will be using 211 to do a housing triage to start that diversion conversation with just some problem-solving conversations before we even put any financial assistance with it. Another thing we like to do with programs is we make these little buckets. We do it with programs. We do it with our coordinated entry assessment. What do you score for? What are you going to get? And so it creates this layered cake. Now this looks really nice. It's very pleasing. When you're going to write this into policy and eligibility, it's really easy to explain. But it's not reality, right? Life looks a lot more like this. Whether somebody qualifies, especially whether it's based on where they slept last night, it's going to change from time to time. What they need for services is going to change over time. What they need for financial assistance is going to change over time. So life looks a lot more like this. With that reality, we are thinking about our programming and how we approach it differently. So this is an example of how we're looking at eligibility for the program for ESG CV dollars. Back at Home is a combination of homeless prevention. That's the activity that you can charge under ESG. It's a combination of that activity, homeless prevention activity, and rapid rehousing activity, but it's all using a diversion or a rapid rehousing approach. Again, those pieces that we're really looking at of the financial assistance, housing navigation, case management, problem solving, those pieces that really, at the end of the day, the household doesn't care what laundry detergent they have, what the name is. They just care that they get what they need, right? I don't care what program you assign me to, what eligibility you assign me to. I care that I get what I need to get in housing and stay in housing. So instead of thinking about this as we traditionally do, which is we traditionally say, here's homelessness prevention, and we're going to allocate 40% of our money towards prevention and 60% of our money towards rapid rehousing. We are not making that distinction. Normally it's, look, let's think about homeless prevention as a bucket, the red bucket. Let's think about rapid rehousing as a green bucket. And we're saying those are arbitrary lines. We want to get rid of them. So instead, we know that we have to look at the living situation for billing. Again, it's for billing. We're going to categorize you for billing as homelessness prevention or rapid rehousing. But how you're prioritized and how you're eligible for the program, we're looking at it this way. Households at a higher lethality risk or with a large number of barriers are prioritized. So as you go through these priorities, families have less and less barriers. And of course, right now we're looking at pandemic, we're looking at medically fragile. So that is our number one priority. And what you see is that we're creating the priorities instead of living situation, we're creating them on, some of those barriers that some of our other assessments do as well, that create that priority. What's different in what we're doing this time is really these two pieces that we're saying we do not want you to have to come into homelessness, come into the shelter in order to qualify for rapid rehousing or for a longer term housing subsidy. We want you to get what you need without having to come into, especially right now when we have reduced capacity, really, difficulty keeping people safe in those congregate shelters. We want people to be eligible for what they need without having to enter shelter. And so you can see in that priority one, we're doing a combination of folks who are at that shelter door. We're not going too far upstream into eviction prevention. We have other programs for that. But it is for people who are presenting at that shelter door that are at that really targeted diversion at risk of homelessness. You can see the order that we serve here. I think another thing that we are really trying to think about differently, of course, is how we decide who should be eligible for funding. And, I got to say, it was so freeing after Hurricane Florence that we did not have to worry about who we could and couldn't serve. It was, normally we in homelessness, we have not enough resources for the need. And so we have to play this game of how can we make sure that we're making the most impact with our dollars. And I think, hopefully right now we're making good decisions with our investments that will be able to serve a lot of the folks that need it. And we know that there's still a problem of scale. We funding and honestly workforce. Do we have enough people who know how to provide these interventions? So that's one of the things that we're focused on with diversion as well, is really just training. We're doing a lot of training for our back at home rehousing agencies of the basics of rapid rehousing, the basics of housing navigation, advanced housing navigation, centralized housing navigation, all of these things. For barriers for prioritization, we have moved away from using the VI SPDAT. Many of our communities have used the VI SPDAT for coordinated entry, and we've decided to not do that for this funding and this program for back at home. And one of the things that we're doing here is we're really, again, we're trying to not get folks caught in boxes and where we put them in buckets and then you have to wait, where you say you need a really high level of intervention, and instead of helping you with something now, we're going to put you in this box and you'll be on the waiting list until that intervention becomes available. We know that that does not work. It's not working for our communities. It means that people are really languishing in the homeless system, especially folks who are most vulnerable, who need it the most. And so we're working on this prioritization in a different way, and hopefully a more dynamic. What you saw with our different levels is that allows us to go very dynamically through the list instead of saying, we've placed you on this list for this intervention, and we're going to wait until it comes open. One of the things that we're this is the first time we are using these barriers, and it's also the first time that we are thinking about how we can impact racial disparities or how we can address racial disparities in a different way. And so you see one here that one of the barriers to getting and keeping housing is a household is from a disproportionately impacted population. And in North Carolina right now, if you are African American or if you identify in the LGBTQ community, you are overrepresented in our homeless population. And so if you are in those populations, you would have that barrier listed, which would help prioritize you in the order that we're able to serve folks. So not necessarily if we're able to serve folks, but really just that queue order of prioritizing of serving. So this is the way that we have, you cannot use race because of fair housing. We could not say, if you are African American, we are going to bump you up on the list. That's absolutely not something we can do, but we do know that because of systemic racism that exists within our system and within all of the feeder systems to our system, we know that this is something that we want to address. And so that's the way that our state has decided to work on addressing that disproportionality. And of course, over time, that disproportionality hopefully will change, which means that that population that is disproportionately represented could possibly change. And so that would change as well. Or hopefully we'll get to a place where things are all said and done are more even, and that won't be a barrier that comes into play as much. So I went really quickly through how we are suspending our thinking, how we are trying to move out of these buckets and these rigid ways, and we are trying to think about it differently. Again, what does it all boil down to? Well, while these layers are very nice, that's not the reality of people's lives. It hasn't been the reality of people's lives, and right now in pandemic, it's definitely not in the reality of people's lives. Life is a lot messier than that, and so we want to focus on those three things: the affordable housing, appropriate services, adequate income. And I've got 6 kids here with me today. 2 of them are mine. We're rethinking school. Every day we go through this curriculum and I think, is this really the way that we should keep doing it? And the truth is, when we look at these rules, sometimes we start to think it's a universal law and it's something that always has to be. And the real truth is, people made it up. We made these things up. The fact that homelessness prevention and rapid rehousing is 2 different billable activities is something that we made up. I know that some of the people who helped make that up. And so there's ways that we can rethink it as well. And so I just like to encourage everyone to rethink those approaches and boil it down to basics, so you don't get so caught up in, is this right, is it wrong? Because the truth is, there's no clear right answer, but there are clear wrong answers. And the wrong answer is to not do anything differently. Kristi, I'll turn it back to you.
Thanks so much, Denise. That was fantastic. Really appreciate that. Looking forward to the questions that will I know are coming in. So we are going to move on to our panelists from Connecticut. And just so that I know you're seeing what I'm seeing, Mia, can you confirm that you can see my screen?
Confirmed.
Okay, great, thank you. All right, so I'd like to take a minute to introduce you to our two panelists, Diana Berube. I apologize, Diana, if I mispronounced that. Diana joined the Connecticut Coalition to End Homelessness in August of 2019 as a program manager for prevention and exit strategies. Her main focus in this role is training providers in the practice of shelter diversion and assisting in the administration of flexible financial assistance to those on the brink of homelessness. Diana began work in the homeless services field in 2015 as grant coordinator at her local Board of Education under the McKinney-Vento Act. She also has 3 years of experience in street outreach, assisting those individuals experiencing literal homelessness, and as a diversion specialist doing direct client service in Connecticut's coordinated entry assessments. Bobbi Riddick is the assistant CAN coordinator, and I'll just say CAN means the Coordinated Access Network, for the Meriden, Middlesex, and Wallingford counties. I'm sorry, not the counties, the CAN, the Coordinated Access Network for those counties. Bobbi was born in Waterbury. Am I even saying that? Waterbury? Okay. Youngest of 3 daughters of 2 natives of the South. Bobbi is a graduate of Lincoln University in Pennsylvania, a current MBA student at the University of Connecticut. Bobbi is a walking example of strength and diligence to serve in the community. Bobbi has work experience with underserved youth in Philadelphia and in New Jersey. And upon her return to Connecticut, Bobbi provided reentry services for the Department of Corrections, was a substance abuse counselor, and a mentor for youth. Bobbi's desire is to provide service to low-income households in Connecticut and to empower advocacy amongst the Black, Indigenous, people of color communities throughout Connecticut. So thank you both for being with us today. We are very excited to hear about how you are using diversion as a strategy in Connecticut.
Thank you, Kristi, and thank you for having myself and Bobbi today to talk about the work that we're doing in Connecticut. In Connecticut, we really have a focus on making sure that we have a common goal of making any episodes of homelessness rare, brief, and non-recurring. And the reason I like to use this photo is that many people that are experiencing homelessness share that they feel that they've lost their name, they've lost their face, and they've lost their identity. And they are just labeled as homeless rather than someone experiencing homeless. And that brings me to what does the word homeless mean? And it can mean so many varieties of things. It can be that someone or household does not have a home of their own or a lease in their name, and that maybe they've just lost one of those things. And they're relying on their natural supports, their family, their friends, for a roof over their head. And that can be what we call couch surfing. And that can mean also a variety of different things. It can be that you have maybe an aunt that has a spare room and you can stay there, but only for a month, or to an extreme level of frantically calling on a daily basis every natural support, every family or friend that you can think of to beg for one night stay. It can even be reaching out on social media to acquaintances that maybe you've just come across and asking them for help. Next slide, thanks. So those varying levels of housing crisis can be helped out with different levels of housing intervention. So that brings me to our coordinated access system overview. This is a flow of the homeless response system in Connecticut, and it starts with, across the state, if you are on the brink of homelessness or you are experiencing literal homelessness, you can call 211 and have a conversation with a call specialist. That call specialist will walk you through a brief problem solving conversation and see if they can help you identify a stable housing situation, even if it's just for the night. If the call specialist is unable to divert the client over the phone, then what we were doing pre-pandemic is clients would be given an in-person appointment for a coordinated access network assessment. Currently, we're doing all of those assessments virtually and by phone because of the pandemic. But again, this stage of the homeless response system would be so that somebody can have a really more in-depth problem solving conversation. It can be up to an hour long, where we identify what their barriers to housing are, what possible solutions we can come up with. And if that assessment does not yield a solution, then the client would be given either a shelter bed or placed onto a prioritized waiting list for a shelter bed. Not ideal. At that point, we would hope, and we do try to connect that person who is experiencing literal homelessness that night to a street outreach worker who can continue the problem-solving conversation with them. And again, at that point, whether somebody has entered emergency shelter or been contacted by a street outreach worker, we do actually conduct what I believe Denise said in North Carolina they're no longer using, but we do actually conduct the vulnerability assessment. That's the VI SPDAT. That will get some, either an individual or household onto our by name list of those that are in greatest need of housing interventions. And along these lines, from the first call to 211 all the way down to experiencing literal homelessness or being in shelter, there are different levels of housing interventions that we do use. But I use this slide and I really want to focus on the word diversion we think of in that problem solving conversation is happening only at that front door of homelessness, at that first call to 211. And I truly believe that that diversion conversation can be had at every single stage of our homeless response system. And it's important to note that the 211 call specialist is well versed in how to do that problem solving conversation. The CAN diversion specialist is well versed in how to do that problem solving conversation. But in Connecticut, we really focus on also our shelter case managers knowing how to do diversion, our street outreach workers really understanding how to do diversion, and working with people all along the way to come up with creative solutions to stable housing. All right, thank you. Next slide. So why is shelter diversion effective and important? I think, Kristi, you touched on this a little bit. Any experience of homelessness is a trauma in itself. And having my own experience in direct client service, I can tell you that, you know, meeting somebody that's on the brink of homelessness and how they identify, not just physically, but their mental health, their physical health, is very different from somebody who's been through the homeless response system, has had a period of street sleeping, or had an extensive shelter stay, will present in a very different manner, and they tend to deteriorate the longer they experience homelessness. So we really try to work with people that are on the brink of an episode of homelessness to eliminate what might happen in the future for them. Again, shelter diversion is also very cost effective. While emergency shelters are free to the people that need them, they're not free to our community at large. The staffing, the building, all of those are costly to our state. Also, shelter diversion is important because we do have limited space available in shelter. We have a limited number of shelter beds, and we have to really try to prioritize those that are most in need for those beds. Shelter diversion also builds on a client's strengths, and it's empowering for people. And it takes into account client choice. So I want to talk a little bit about the realities of emergency shelter and what it looks like. And I think that in the community, we have some misconceptions about what emergency shelter is and what it's needed for. So this is a picture of what a shelter might look like. And not all shelters look like this. Some are very nice. But most oftentimes, it's a congregate living situation, which we're really trying to focus on eliminating the need for, especially during a pandemic. Next slide. So some shelter realities. In Connecticut, we are housing first. That's our principle. And so that's not just housing first, let's get you into a stable home, your own apartment. It's housing first for shelters as well. So we want to eliminate as many barriers as possible for those that are in need of shelter. And one of those things is that many shelters are what we call wet shelters. And what that means is that clients that are experiencing active substance abuse are allowed to come and rest their head at night. We recognize that many people that are sleeping out on the street are experiencing substance abuse issues, and we want to make sure that the resources are available to those people too. But that does change the atmosphere and the setting of an emergency shelter. Shelter realities also is, with it being low barrier, we have a reduction of rules and policies. Again, there's very little privacy in shelter. Bunk beds usually stacked side by side. There may be safety concerns, and again, we have rules and regulations, and we really try to make sure that, you know, anybody that's creating an unsafe situation for themselves or someone else, you know, would be asked to leave and calm down and come back. There's minimal staffing. There are hours and regulations on when people can enter shelter in the evening and have to leave again in the morning. It can be a traumatic experience for people. It's a congregate setting, which we don't want people to be exposed to a possible COVID-19 case. So we're really trying to work to keep that congregate setting as limited as possible. And most importantly, I think the misconception is that I want to address is that shelter is not housing. Shelter is a temporary solution for folks. And within Connecticut, most of our shelters have about a 90-day period. So we expect that upon entry into shelter, that somebody will have at tops 3 months before we can come up with a stable housing solution for them. Next slide. So that brings me to Bobbi, who's going to speak about how we create what we call a housing stabilization plan.
Thank you very much, and thank you for this opportunity to speak about our housing stabilization plan and diversion work that we're doing here in Connecticut. So with a housing stabilization plan, it's really implemented at the onset of a CAN assessment. When Diana described the flow map of when someone communicates with 211 and then they're set up with what now is a virtual appointment, we're doing our assessments over the phone, we really get an opportunity to kind of speak with the client and really go into depth about what, you know, their current housing situation or their living situation is. And a lot of times, you know, you're asking, you know, for people to divulge, you know, what has been their experience over the last 3 years, over the last couple of months. And, you know, it's a lot of information. We're doing active listening and we're trying to capture some key points, but it's really, you're having that conversation with the person. And anytime that you're having diversion conversation at a CAN assessment and shelter, you know, you really want to keep that flow and open that conversation to really understand what a person's experience is, and also to kind of open up that dialogue of, you know, receiving information and the resources that you're going to provide to them, because you guys are talking about it, you know, and really kind of hearing each other out. So in the light of, you know, of a CAN assessment, you know, and having all this resource and conversations that you're having, we thought it was, you know, definitely best that this housing plan or stabilization plan had been piloted, I want to say maybe about 2 years ago. And, you know, we wanted to give people information, not only in the CAN assessment, but, excuse me, that's my timer, not only in the CAN assessment, but to really, sorry about that. Dismissed, sorry. So to really, you know, really, again, take the information that is discussed in the CAN assessment and have something that they can carry with them. Where our housing plan, we have three different tasks, different steps that we encourage people to kind of refer to, and it has different resources listed on it. And again, so that after the conversation in the CAN assessment, someone can really look at this piece of paper and say, I remember, you know, this person mentioning this, and I remember someone mentioning that, and, you know, really having this tangible document to kind of take away. So I encourage anyone that's having CAN assessments or diversion conversations to really, you know, create a tangible document that people can refer to if in the event that they experience a housing crisis in the future. So really identifying someone's barriers, you know, again, having that conversation with a client in a CAN assessment or in shelter, and, you know, and it really kind of helps you as the receiver of that information identify and kind of process of elimination of resources that someone has used before, or that resources that have been helpful, or not helpful, so that you can also know to identify, you know, what resources to refer to that individual. So if something didn't work, you know, before, you know, you don't want to keep kind of having that person go along that will if they've already kind of exhausted that resource before. But it also lets the client know that you're having and engaging that conversation with them and really talking to them about what barriers that they have. And when you have that conversation, people are more open to receiving, you know, some information back from you. So addressing, you know, concerns of income, which is always, you know, on the forefront of, you know, all of our minds, or how are we going to increase our income to sustain ourselves, or just to survive, right? And this is an area that I really like to kind of talk about with clients that I come in contact with, or even, you know, people in the community that I come in contact with. Just really being open to receiving additional job readiness skills, right? And if they've used some job readiness, you know, skills before, okay, let's identify those, let's write those down and add that to your stabilization plan. But let's also be open to, you know, maybe connecting with an American Job Center that we have in here, Connecticut, that has career navigators that can communicate with someone over the phone. Really kind of talking through maybe temp agencies, really kind of, again, providing that conversation in a step-by-step for someone to kind of really, you know, to kind of, again, make those next steps in whether it's increasing their income or providing some stabilization for themselves. Natural supports. A lot of people will say, I've exhausted all of my family, right? Like I've exhausted all of my friends. I can't return back to them. But it's really good to know about where a person slept last night, right? And again, in that conversation, what resources have they used before? If they have stayed with natural supports before, is it a matter of revisiting that conversation and talking about, you know, well, I have a little bit of income now. Can I pay a utility bill, you know, to kind of stay, just to give myself some time to look for an apartment, right? You know, just really, sometimes we've even gotten on the phone sometimes with family members and friends and saying, you know, if the client allows us, of course, to say, look, you know, this person has a plan now. We have a sustainability plan, and you know, they're going to be working on X, Y, and Z. Can they stay with you, you know, for a couple of more weeks, just to give them some more time to really, you know, be successful and really work to sustain themselves in the community. And also providing, you know, that information with community supports, community action networks, you know, some case management referrals. It definitely in Connecticut, we refer people to, you know, utilize those and really take those independent steps of their own to make those phone calls, because we don't want people to say, oh, well, let me just call Bobbi, or let me just call the can and they'll do this for me. No, I remember that I called this number and I was able to get connected to this resource. So really empowering and equipping people with resources, right? We have a website of 211ct.org that I always refer people to, and I always make sure that's on their stabilization plan, because they can type in a keyword and they can type in their zip code, and it can pull up any resource that's available in that zip code, and a telephone number, a brief description, and they could really, just in case I missed something or our can assessors missed something, they can really spend some time on that resource if they have the accessibility to internet, which is another you know, that could be a barrier to people having Wi-Fi, and with the public libraries being closed, you know, due to COVID, you know, just really seeing where people are, you know. But if they could have an opportunity to utilize the resource, you know, on the website, then, you know, we definitely put that on the housing plan. But again, it's really created to help people refer back to what resources were discussed with them. And again, that is empowering. That's motivating to them. They can say, look, I did this, I made this call, I you know, utilize this resource. Or they can even spread that information to another friend of theirs or someone else that is experiencing homelessness or a housing crisis. So the housing plan is a really good, you know, way that we like to, you know, definitely in Connecticut, to make sure that people are receiving information in the long term and resources that they can return to. Next slide, please. Okay. So, oops, sorry, motivational, so conversation. So I really kind of talked about, you know, kind of opening that conversation and really getting in the practice of, you know, having, encouraging, you know, and really strength-based approach. A lot of time that takes practice, you know, and I train a lot of our can assessors in our region, and I really encourage, you know, really uplift, find out, and really identify and listen. That's a big thing. listen to the clients when they're talking about, you know, what resources they have used before. You know, that's also in identifying and capturing that and writing that down, and really kind of encouraging the client in that way to say, well, you know, you've been able to, you know, pull this resource before, you know, you've been able to utilize, you know, these, you know, again, these resources, or these resources that you have within yourself, or your resilience within yourself, or knowledge that you have. And let's kind of feed off of that. Let's really kind of, you know, put that into practical steps. And sometimes, you know, those practical steps can be helpful when you put it on the housing plan, but also sharing that housing plan, or encouraging that client to share that housing plan with, whether it's a mental health provider that they're working with, or a case manager that they're working with. We do upload housing plans to our HMIS, which is our database system. And, you know, anyone that has access to that, or can talk with, you know, come in contact with the client, they can also see that plan, so that we're all kind of like on the same page about what, you know, what supports that a client may need. And again, it's really the client's plan. It's their plan. We can make some recommendations, but in that strength-based approach, you know, encouraging them and pulling out, you know, what are some things that they can really kind of, you know, really do and be well at, or kind of, you know, exercise and sustaining themselves. I'm going to turn back to, you know, really have in this conversation listening. Trauma informed is a big thing. It's not only, you know, some of the trainings that, you know, I know we go to trauma informed, you know, trainings every year, and that's good tools, but also, you know, just acknowledging someone's trauma, acknowledging that, you know, homelessness and, you know, is a trauma in itself. It has effect on the families, it has effect on the children, and, you know, and particularly with racialized trauma as well, you know, throughout, you know, systemic racism, hearing people, listening to them, and acknowledging, you know, their story. And sometimes we have to just sit back in our CAN assessment and listen and hear. And you can get some really good information from the client about their experience, but ways to, you know, again, to support them, and how we can do better as a system to help people who are experiencing trauma, who are experiencing, you know, just homelessness in total, but also, you know, with that racialized trauma throughout the system as well. You know, just kind of figuring out how we can just work better to kind of help that person get through that. And again, kind of coming up with those tangible steps. And that leads into that, empathic listening, you know, and just really kind of having that conversation. So keeping that in mind, this is still a person that's in front of us. This is still a person, you know, that could have been, you know, one of our colleagues, you know, that we've talked to that may be experiencing homelessness. That happens, you know, where your colleague is going through a rough time, and they're having to go through the homeless system at times. You know, this is, you know, we're all kind of sharing a same boat of trying to survive. So keep in mind that this is a person that's in front of you, and if we could help provide any resources, or help them feel valued and validated, and just not another, you know, just not another homeless person, you know, that's in the street. We want to, you know, let them know that we value you, and we want to help you to move forward. And hopefully this housing plan can help create some steps, but here are some additional supports for you. So really, you know, turning those CAN assessments or those interactions into conversation pieces that really kind of encourage the client to be a steerer of their own success, I like to say. Next slide, please. Okay, so coordinated entry during the pandemic. Right now, we are entirely working over the phone, doing CAN assessments remotely, and we're trying our best to communicate and capture as many people as we can. We have their set times or set days for their CAN appointment, and trying to reach them. Some of the barriers are, you know, people actually having a phone, you know, and having the availability. They may have the availability to call 211 to make the appointment, but will they be, you know, around the same person that let them use the phone to have their CAN assessment? Do they have any, you know, minutes to actually have the conversation, or to use Wi-Fi? We want resources, again, to be accessible to anyone. So it's like, you know, giving some of that housing plan, that initial, housing plan or stabilization plan, or even giving, people that 211 website so that they can have access to resources at any point that they have, Wi-Fi or a phone, available, and just really trying to give as much information as possible at that CAN assessment, because we don't know if they're going to be able to speak with us, or, if we're going to be able to follow up with them, in the future. So we try to give as much information as possible. And at times, we will actually try to bridge that referral for at least case management if we have the capacity. But, these are definitely some issues that we're working through, as far as, people's accessibility. But so far, it's been okay. Sometimes we've had to actually help people set up Google accounts, Gmail accounts, so that I can send them, information so they'll actually have it. And texting is also a really good resource for people too. If they don't have minutes to speak with me, they can definitely text with me. So it's taken some creative work and creative initiative, and I empower everyone to revisit, your diversion practices right now, and really figure out, how to, or really figure out how to be more creative, as possible. We're all charged with trying to, come up with best practices during this pandemic, but really, increasing, those resources before shelter. Shelter is not the only option. It's the last resort, and having those and that investment in diversion conversations, or in the diversion, and diversion stages of a CAN assessment, having those tools, and really kind of investing in your staff to make sure that you feel comfortable with diversion conversations and that they're able to share information. So I encourage those creative thoughts, and those creative new practices. We can always grow and learn. I'm definitely, appreciate the work that we've been able to do here in regards to diversion and helping people get housed. We've been able to help people get into their own apartment, which is the safest place to be right now.
Bobbi and Diana, thank you so much. We appreciate you both, and Denise, for sharing what is going on in Connecticut and North Carolina in your communities. Such great information, so much great information. And there have been lots and lots of great questions that have come in. So we're going to move to the Q&A portion of our webinar now, and Mia is going to join. And Mia's task, it's a difficult one, is to kind of narrow down for our remaining 15 minutes, the best questions. We will try to answer any that are coming in, but we're going to transition over to Mia now. Thanks, Mia.
We got a great question, and it's open to any of the panelists. What is the role of housing first in shelter diversion? And I want to preface this with the idea that, at the front door of the system, you're having people who, have all different kinds of experiences and backgrounds and barriers. So what is the role in that, in thinking about that, what is the role of housing first and having that mindset when you're having these shelter diversion conversations?
I think I can speak on that a little bit. So housing first, definitely is, I think it's the conversation. I'm always going to go back to the conversation that you have with people, and really getting people to see beyond their crisis, if you will. And, I know that can be hard, because if you're in a crisis, you're trying to figure out what can I do immediately, but also helping people to understand that, yes, there are certain things that we can address right now and we can help you through, but I also am going to challenge you a little bit to take it one or two steps a little further. And can you see, you being in your own home, right? Can you see you being able to, have your own space, and in other than shelter, and really focusing on, that bigger picture of helping people come, for a moment, if they will, with me, to come out of the space of a crisis, and seeing past that, and what steps that they can do that can really help them to self-resolve. So at a CAN assessment, we definitely, try to encourage that, that image as much as possible, to help people to see that they can do this. You can do this. Picture your house right now. Picture your, what welcome rug that you're going to have in front of your door, you know, like picture that. And sometimes people are willing to go there with me and sometimes not, but we definitely, you know, encourage people to strive for that big picture if they will, in that moment. And sometimes it's helpful, you know, and just, again, sometimes I'll just say human to human, having a human to human, person to person conversation. You know, go there with me for a second and let's talk about how we can get there.
Thank you for that, Bobbi. And I think you hit on a great point that as a system, as providers, we need to be able to focus, have housing be our primary focus, getting that person into housing, no matter what their circumstances are, but also helping people for themselves to really focus on housing, rather than thinking that they need to become sober, thinking that they need to, you know, accomplish certain things before they can get to that point of housing. So I'm happy that you were able to bring that up. And I want to ask a question to Diana about, you know, the statistics. How are you seeing diversion working in Connecticut? What are the stats that are saying that, you know, diversion really is making an impact when organizations are, you know, all doing it and working together?
Yeah, I think across the state, we've got varying levels of diversion percentages of those households and individuals that are coming through the system. The highest diversion rates that we're seeing are up in the like 60%. You know, if we can keep that many people out of shelter, it's really great work.
Absolutely. And I want to open up, this is to either the panelists. Denise, if you want to jump right in there too. What is the definition of self-resolving? What does it mean for a person to self-resolve? Oh, and either one.
I'll go ahead. So self-resolving would mean that without, so it might mean that we provide somebody with, you know, referrals to other supports, you know, maybe a child care situation or case management of some kind or mental health services. But self-resolving means that they've resolved their housing crisis without any financial intervention.
Awesome. So we have another great question about the predicament of being limited and having to do virtual diversion appointments during the pandemic. So we can, you all can just talk about some of the challenges that you face in having to do phone diversion, and also any barriers that you've noticed that people have faced with being able to access, you know, phone diversion and just in general services during the pandemic.
I can say, I think one of the, you know, having the over the phone conversations with people, you know, having access to charging their phone, I think is a big, you know, big barrier. You know, if you're sleeping outside, how are you charging your phone, right? And, you know, just having, again, how I mentioned, we're sending resources via email at this point. And if someone doesn't have an email, well, I'll try to help them set up one really quick, so that I can send them resources and they can share that with other providers. But, you know, if they don't, then, you know, writing down, and then again, you know, having maybe pen and paper to write down information. So that's been a challenge, and we've tried to get creative as possible. That's why we definitely ask, are you working with any provider right now, you know, that is willing to speak with us, whether it's a mental health provider, whether it is, you know, anyone, case management, but as a follow-up, we try to identify where the person is in the community if they're sleeping outside, and we do follow up with outreach referrals who can kind of go where the person is safely, and, you know, try maybe share some of those resources or facilitate an actual call to case management, or, you know, just to try to kind of bridge some of those resources for someone who doesn't have access to internet or the phone.
I would add to, thank you, Bobbi. Like, that's definitely, we're recognizing our limitations these days. But in that problem solving conversation pre-pandemic and being able to do the in-person appointments, what's so key in creating a safe space for somebody to talk is oftentimes body language and your facial expressions, and really making sure that the client doesn't feel judged in any way for, what other crises they're involved in at the moment, aside from their housing. And so that's a little bit difficult, and we're really, training our diversion staff and really working with them on making sure that they're utilizing active and empathetic listening over the phone.
Absolutely. Thank you for that, Diana and Bobbi. And Denise, I want to loop you into the Q&A portion. And I know someone asked this question in the Q&A chat, but I want to be sure we can ask it out loud. If you could just elaborate a little bit more on what you all are using in addition to the VI, or as an alternative to the VI SPDAT.
Yeah, thanks for the question. So it's not an easy thing to move from one tool to another, and I detailed some of that in the chat. I think to be clear, we are using, for program intake for back at home, we are using a different assessment with those priorities that you saw listed. So I did put in the chat as well a link to where the training is, that will go through more of the decisions behind what the priorities are. You can see them then more quickly than I flashed them, the thinking behind it and how that's being used by programs. So we are, to be honest, we just have found some problems with the VI SPDAT in several of our communities. We've found that our use of it, we found that it creates buckets and it creates some long waiting lists. If you don't have those interventions that people score for, you can kind of get stuck there. And so we wanted to solve for that. So that was one thing that we wanted to solve for. So we did create our own assessment. And you can see the priorities. It's probably not perfect. It's probably something we're going to change as we use it. And the other thing that we saw with the VI SPDAT is that we've had some of our own experience with, we are the lead agency for the Balance of State Continuum of Care, so some of our own staff experience. One of our communities in North Carolina identified a bias, and then we've seen that I'm losing the community, that we've seen a racial bias in the VI SPDAT. And so that's just something that we wanted to get away from and try something else. So, I pointed out specifically how we're looking at that historically, or that we actually went through like historically marginalized, or we landed on disproportionately impacted, because we really are trying to be just thoughtful in how we can make sure that we're checking the bias that we have in our own system, as well as advocating against those biases in other systems as well. So we are using it now for the Back at Home program. There are still some communities within North Carolina that are using the VI SPDAT for coordinated entry. And so we're working real hard to try to make those intersect together. And I do think that it's something that we'll start to see folks move away. Hopefully, if this one works well, we're piloting it. If it works well, hopefully it's something we can use for the whole system.
Awesome. Thank you for that, Denise. And I wanted to just give one more question before we wrap up the Q&A session. We have a question about how long diversion programs are, but I wanted to open up that question to talk about diversion as a practice. While there are diversion programs that exist out there, what is something that diversion is really something that anyone can do, whether you're within the homeless system or not. So I wanted to open it up to the panelists to talk about diversion as a practice.
So I will say that within our homeless response system, within the CAN appointment setup, the diversion specialists that are meeting with people at that first level have different capacities statewide to follow up with clients after that initial call. So the diversion as a practice can continue, those conversations can continue. Maybe we've diverted somebody to a friend's house, but it's only for a couple of nights. And then what are we going to do 2 days from now to follow that client and make sure that we have a stable housing plan in place, and following our housing stabilization plan that's been set forth at that initial meeting. But within CCH, within my organization, we provide training statewide, so anybody can come to a diversion training and learn about the diversion practice. So we've had, you know, anyone from hospital staff to library staff to, you know, local community partners that have come to our diversion training and learned about, you know, what we're trying to do in Connecticut. CCH is running right now a municipal campaign, so we're reaching out to mayors across the state, we're reaching out to municipalities, police officers, probation officers, Department of Correction and Families, to really teach people about why we want to keep folks from entering our shelter system in the first place.
Mia, thanks so much for facilitating our Q&A and for each of our presenters for engaging in that. There was quite a bit of chatter in the Q&A. And I know that there are a few questions in there about links to some of the things that our panelists have posted. So just note, just to reiterate again, we will post this recording, we will post the PowerPoint presentation, we will post the infographic, and we will post the Q&A. Come back for that maybe in a few days. We will try our best to answer some of the questions that did not get answered in our Q&A. And so when you download the question and answers, you'll be able to see what some of the folks asked, and where we can answer those questions, we will. So we'll provide that for you as well. Also, just one more note, the Alliance does not provide CEUs or certificates for our webinars, but I do want to put out a plug that the Alliance has launched the Center for Learning. It's our online learning platform. You can visit endhomelessness.org and learn more about that. We will have a diversion, introduction to diversion, go a little bit deeper than maybe what we've gone into here, a little bit more into the practice side of it. That will be available to folks in early part of 2021. We will build off of that introduction into more intermediate and advanced courses. These will look like self-paced online courses. They will also, some of them will have kind of a live interactive focus to them as well. For those, we do offer certificates, and actually Mia right now is working on CEUs for some of that stuff. So just a plug for that. So if you haven't signed up for our newsletter, please do. You will always get an announcement for our Center for Learning. Last, anybody who registered for this webinar will receive a follow-up email letting you know that the recording and all the materials that I've just laid out are available on our website with a link to that page. So look for that in your email as well. So thanks so much, everybody, for joining us. We hope you got something out of this, and we look forward to seeing you back here soon. Have a great day.